We joining us. We joining us. Trying very fast. Oh, my hair is getting old. We joining us. We joining us. We joining us in this life. We have a long day. We are going to talk a lot of things. So join up. Join up. Join up. This bright of you. Join up. You're welcome. Join up the life. You're all welcome. Hi, hello everyone. You're all welcome to my live section, my live stream. Where I'll be teaching everyone how to use HIV test by yourself. How to do HIV test. Okay, network is quite bad, but we are open HIV. A lot of persons are scared of checking their HIV status. A lot of persons are really scared of checking their HIV. Some persons, they don't want the health provider to even know their HIV status, but we are not even doing anything with it. But some are saying, I'm coming, some are scared. Some are scared of checking, and some, when they know their status, they don't like doing anything about it. They don't just like taking the drugs or anything. Okay, so when you've checked your status and you know if you're positive, please try to be taking your drugs, okay? And if you have checked your status and if you're negative, congratulations, you can go and check again after 6 months. Okay, every 6 months you can still go and check again. So a lot of persons are actually scared of checking their HIV status. That is why I'm making this video, so that you won't be scared. You will check it at the convenience of your home. No time for you to be scared, okay? So this video is for, this live stream is for everyone out there. So if you're joining me, you can say hi. You're all welcome to my channel, where we talk about health, we talk about lifestyle, and everything concerning you, your health. We talk about them, okay? And also we talk about drugs that you can use for most of the ailments or sickness, whatever we call it, or diseases around. Okay, so you're all welcome. If you're joining me, if you're one of my beautiful fans that used to follow me, just please tell me hi. You're very welcome for joining. Thank you for joining. I can see a lot of persons are joining. Just say hi, give me hi, and that thumbs up button, please don't forget. Today I even purposely close the love button so that you will see the thumbs up and you subscribe. Please like, subscribe, and follow me for more. You are all welcome to this live stream. I'm just coming up. So we are going to be talking about wonderful year. Let's talk. Oh, someone just like, thank you. Woo! Thank you for the like. Network is not that wonderful year. So please, you all will bear with me. You will bear with me. Network has been fluctuating for some time now, but you will bear with me so that we can do this very well. We will not be please bear with me, okay? And how we are going to be doing everything, I might be using this background and shifting some things later, but as you all are joining me, you're all welcome. So I said we are going to be checking, doing HIV test. Okay, so who is the sample? Free pharmacist, God's gift. Oh, network. So I'm going to be the test, whatever. So I'm going to be the sample. Okay, I'm going to be the sample. So this is the test kit. Okay, these ones you guys get them anyhow. Okay, because they are given, I think they are given by WHO or so. So if you want the test kit, you can still say I want, or you can order, and we'll see how we can get it for you and know how everything is. So this is called Aura Quick. Okay, the one I'm using is Aura Quick HIV self test. You can see is self test. Okay, that means you're going to do it by yourself. Okay, refer to testing direction inside the pack. I'm going to be reading everything inside the pack. We are going to be following it step by step. So please, if it's taking too long, Biko, bear with us. Okay, you have to bear, because in doing this test you don't need to rush. You don't need to rush. Where are we rushing to? Nowhere. So you don't need to rush, so that you will get it rightly by yourself. You will not go and make mistake. Okay, so the contents, what we have inside this pack, we have the instruction for use, the test tube. This pack is just like a complete pack that have every okay. We have preservatives, and also we have the developer vial, we have the test stand. Okay, those are the things that we have inside there. So there is preservatives and there are a lot of things inside there. So take a proper view. If you are writing it down, you can write it. If you are in a place that you can get the this thing, you can still get it out. Okay, but if you're not in a section, or tell me, so that we know what to do. So if you are my friends, like my friends that have been following me, please just tell me I. Let me tell you I too. Let's greet ourselves properly. Okay, let's greet ourselves properly. Okay, so let me carry gloves. This one, that's my head, this hair is, old and is scratching me. I'll be needing this one. Before they say this woman is doing laboratory tests and she's not carrying gloves, so I'll wear gloves too. Okay, yes, some people find it hard to wear gloves. Yeah, we already, I put it on. So I want to pierce someone. Who like pierce? Who? Come out, please, come out, come out, come out. Let me pierce you as this thing. Yes. Yeah, Damien Gra, Ngra, Gra, Ngra, Damien boom, ba, ba, boom, ba, ba, boom, ba, ba. Damien Gra, Ngra, Ngra, Ngra. We are doing this test. Okay, so that is all about the test. I don't want to take anything too serious. Let's have fun while we carry out the HIV test, because I know a lot of people are scared of carrying out HIV tests. There was someone that was having serious diarrhea. Now I know I'm supposed to tell you the symptoms of HIV and all those. Okay, one of the symptoms of HIV is unintentional weight loss. Okay, you just be going slim without anything. You know you're eating well, you're just going lean. Okay, that is unintentional weight loss. That is one of the symptoms of HIV, and also steady diarrhea, queen frequently. Okay, there is someone that I said she was pooing frequently. Like she said, when the food enters, she will poo. Even without the food entering, she will poo. She will poo like how many times a day? Watery poo. So I said, come, let's do HIV test. She said, HIV? That where will HIV come from? God forbid, not me, HIV. That was how she just left. I was like, is it bad that I tell you that I want to do HIV test? I want to tell you the test. I would have just taken your sample and go and do that. That would be, you know, that will not be professional. That will not be our professional thing. Like, not telling you what you want to do with your sample. You just take the sample and go and run. So who will pay? So the woman just left. So that was all for that. That is why I'm telling you, we that we are in the field, we know that a lot of persons are scared of doing HIV tests by themselves, and I know, and I believe that. And I know some persons watching me too. Okay, so you've spent 8 minutes. So those are some of the symptoms of HIV, okay? Unintentional weight loss, among others. You should just ask Google about some of the HIV. So you make sure this network, this our test kit has not expired, is good, is still good, and everything. So let's open up and let's check. Whew, please, sorry for that. Network is really dealing with me. Oh, 3 minutes. Oh, Jesus. Sorry for the network issues we are having. So these are the things that are inside the pack. This is it. Two. Look at them. So these are some of the things that are inside the pack. a better view. Okay, these are some of the things. Then you have your leaflets. I will still open what is inside here so that we will get a better one. Then you have your stand. This was the stand that I was calling, that I say test stand. This is the test stand. Okay, I pray this network. The network. Oh, network. So this thing the thing is wonderful. The leaflet is wonderful. There is one that is written in pidgin English. You can see this is written in pidgin English, and this is written in good English. Pidgin English. Person go dey speak bad English now. You go follow the way dem take talk say you suppose to do the test for you to get correct. Look at the way they spell correct to correct result. Make you no chop. Okay, this is good. This pidgin English one is good. Okay, but so that I will not bite my tongue while trying to read pidgin English in book. Let's use this one that this use English. Okay, so look at it. This is somehow how to do it. Okay, you can still use it and know how to do it. But before that, let me read some things you need to know before we go into the test prosper. As people are joining us, as people are joining the live stream, let's check some of the things that we used to know. We need to know before going to the test proper, because there are a lot of things. Okay, product information. Okay, intended use. So this oral kit is meant to be used. Okay, this one is meant to be used for testing HIV. Okay, for testing antibodies of HIV-1 and HIV-2 in oral fluid. That means it needs your saliva, it needs your oral fluid, your mouth. Okay, this test is intended as an aid to detect antibodies HIV-1 and HIV-2 from infected individuals. Okay, this will help us to determine HIV from infected individuals. Okay, that is what it's all about. Now I want us to get something. Okay, yeah, warning, there are some things that you shouldn't do. Okay, there are some warning here. Let's check it out. Say most people feel a little bit nervous. You see, I was telling you that a lot of people feel nervous. Okay, a bit nervous when taking HIV test. Okay, but if you feel very nervous about taking the test, you may want to wait until you are calmer to get it, or get tested by your doctor or a local clinic. So if you're doing this test and you feel that nervous, like anxious, please, you should wait a little while before you carry out this test. As I've told you, a lot of persons are scared of carrying out HIV tests. Okay, do not use the test if you are HIV positive. Do not use the test if you are HIV positive. So if you're positive and you already know yourself that you're positive, please don't do the test, because you already know you're positive. Okay, use with oral fluid only. The test is not meant to be semen, urine, vaginal fluid, or sweat. Okay, let me explain this. It says you should do this test with only your oral fluid. What are your saliva? Like your saliva. Okay, that is the oral fluid. They don't need your blood. This one, you're not going to use your blood. That is why I say you can do it by yourself at home. Your blood is not needed. Your serum is not needed. Serum is it's the same. It's just like blood. I don't know how I'm going to explain it for you. Just like the liquid part of the blood. Okay, the water part. Okay, they don't need your breast milk. They don't need your breast milk. They don't need your plasma. Okay, the red part of the blood, they don't need it. They don't need the serum, the white part of the blood when sedimented. They don't need your urine. They don't need your vaginal fluid or sweat. They don't need your vaginal fluid. They don't need your sweat for this test. Okay? So that is why I say it's very, very easy and simple. That is it. You just do it by yourself. Okay? That is it. So you should know that it's your oral, your mouth that is needed. Then do not eat or drink at least 15 minutes before taking the test. You get that? Do not eat, do not drink 15 minutes before taking the test, because you might get a very wrong result. Okay, so don't eat, don't drink 15 minutes before taking the test. So if you want to take the test, you should eat like 30 minutes before carry. After 30, you like eat, then after 30 minutes or 1 hour, then you cannot carry out this test. Okay, that is it. Then do not use mouth cleaning products such as mouthwash 30 minutes before starting the test. Okay, so don't brush your mouth, or you use all those mouthwash 30 minutes before taking the test. If you want to do that 30 minutes. After 30 minutes or 1 hour, then you can carry out the test, because their minds give negative result if you do that. Okay, then you should remove any dental products such as dentures or any other product that cover your gums prior to the oral fluid collation. Okay, so if you are the type that used to put on those teeth, you know, all those artificial teeth that they used to put on, or all those things, don't put on that when you want to collect the test. Don't do that. Okay, you can remove them. Okay, so if you notice that this pack is opened or broken, please don't buy, because it means that some things might have been missing, or it means it is not good. So don't buy. Okay, so if today it is after use by the outside pouch, you know, it's okay, that is not necessary. So please, you have to learn how to read the result. Okay, learn how to read the results. Yeah, I'm coming, guys. Yeah, come inside. Okay, 3 only at once. Okay, that one at 800. Now fancy that. Oh, huh? Okay, but now only 3 tablets then. No. Okay. You get different prices. So you get 1 5, 3,000, 1,000. This is now for 3 days of 1,000. My feel will never die. Okay, this one is one for four morning, 4 evening. I will like for 3 days. Whoa. Huh? Sorry, sir. 300. Any other thing? No. You don't want to type it? Okay. Shoutous 100 naira. Thank you. Let me give you 3. Okay. Thank you. I get. Thank you, sir. So guys, that was a quick one. I took a quick step out to sell my market. Okay, I'm coming back. Please, I'm sorry for that. I just took some step out. I'm sorry for that. Okay, I'm coming back. This is our test stand. Let's be here first. And you be here too. I'm coming, guys. Hey. Whew, that was somehow. Now that I'm stepping out, network will not disturb me. Oh. This live stream. Network will just carry me play. Okay, so where we? Individuals must have adequate lining to read. Okay, I was telling us that we should learn how to read the text. Okay, where you are seeing T and C on the text divide and N visible that. I'll show you that when we are starting. Okay, do not open any pouch until you are ready to begin your test. Please, because of microorganisms and everything around, there are microbes in the air. Don't open any of the pouch till you are ready to carry out this test. Okay, do not use the kits if you are exposed to household cleaning product like bleach. If you have finished washing your clothes and you've used bleach, please don't open this. Don't start it. Okay, if you have been exposed to any household product like bleach, they were specific like bleach, please don't use this product. Okay, and do not use if you are age 11 or younger. That is if you're under age. Okay, don't use it. If you're age 11 or younger, don't use it. If you have participated in HIV vaccine clinical trial, you may get a positive result using this, but if not, okay, that is not necessary. So that is it. I've read the do not and the do's. Please, I say don't drink, don't eat, and it requires only your oral fluid. Don't eat, don't drink, and also please do not use it if you have used any products like bleach. After cleaning, you have used your bleach, probably you have finished mopping and the rest, and you want to do the test. No, wait. Okay, wait like 1 hour when everything has dried off. Okay, these are some of it. It's also in the leaflet where you are buying the kit. Okay, so you can still go through that and get everything before you start your this thing. Okay, there are some questions that some persons will want to ask. I want us to take this. We are not rushing, please. We are not rushing. Okay, so the test is still on the way. We are still going to carry it out. I'm still going to carry it out. Okay, so now let's see some questions and answer. What does the test do? A lot of people want to ask. Okay, so this oral quick test, this oral quick HIV test, okay, is an in vitro diagnostic self-test for HIV 1 and 2 in oral fluid. It needs your oral fluid. Okay, the test works by detecting your body's. Okay, they said a positive result does not mean it's a positive result. A positive result, okay, means that you should go to health facility to confirm the result with your blood sample. That is what a positive result means. Okay, then also somebody will say, what is the risk event? Okay, that is not how soon after the can I get myself. Okay, who are those persons that are at risk for HIV infection? So somebody will say, yeah, so what will make me want to go and do HIV infection? What will want to make me to go and carry out HIV test? Okay, some people want to ask that. Now, see the reason why you have to carry out HIV test as far as you are an adult. Sex, okay? Do you used to have vaginal sex? Do you used to have oral sex or anal sex? with multiple sex partner. Even you are not having with multiple sex partners, if you are just having with one person that you don't know their status, you need to carry out HIV test. Yes, you need to carry out it. Okay, so if you're the person that you are having sexual intercourse with multiple partners, either vagina, oral or anal, you need to carry out this test. Then secondly, someone who is having sex with someone that is already HIV positive, you already know this person's status, that this person is positive, probably because this person has told you, I'm taking my drug, my viral load is low, gang. Then you are having sex with the person, you too need to check your HIV status. It's very, very important. Okay, then also between a man and another man, okay, that means sex between two men, okay, those gays that are having sex, they need to check their HIV status. Okay, then someone that is using illegal injected drugs or steroid, you are the type that you are taking illegal drugs, you're injecting it by yourself, or steroids, you need to check your HIV status. Okay, then if you're the type that you know you're sharing needles, you're sharing sharp objects, your clippers, like the guys and also some ladies that used to cut their hair, if you're sharing needles, syringes or clipper in the private in the public barbing salon, you need to check your HIV status. If you know you're not going with your own clipper, you need to check your HIV status. Don't be shy. Okay, it's not something to be shy, because it's gonna save you. So if you exchange sex for money, so if you're the type that usually exchange sex for money, so this type, I think they are calling they're trying to exchange sex for money. You know those people now, yeah, Olosh, whatever. Okay, you know the name. So if you are such a person, you need to check your HIV status every 6 months. Okay, having been diagnosed or treated for hepatitis, this one is very serious. If you have been ever in your life been diagnosed of hepatitis, tuberculosis, or a sexually transmitted disease like syphilis, if you have ever been diagnosed of that, tuberculosis, hepatitis, or a sexually transmitted disease like syphilis, you need to be very serious in checking your HIV status. Very, very serious. Okay, you need to be this very serious. Then another person asks, how soon after you have exposed yourself to these ones that I mentioned, how soon should you test yourself? Okay, now the answer is you can test anytime. Okay, if you're using this test earlier than 3 months after exposure, you might get a negative result. Okay, 3 months after exposure, you might get a negative result. Okay, so you should check again after 3 months to confirm the results. Okay, so especially for those that are in the medical field, like us, that are the health practitioners, all those nurses, doctors, they need to be very serious to check your HIV status, because they handle needles and syringes. Okay, why shouldn't I use this test right as a right reason? So let me see another question, that how accurate is this result? Okay, how accurate is this test? How accurate? Yes, that is question that an intelligent person wants to ask. Then let me tell you what they did in a clinical study. In a clinical study, 900 persons were unaware. 900 persons were unaware of their HIV status. Okay, I want to tell you how effective this is. 900 persons were unaware of, and the result shows that 153 persons were HIV positive and 724 persons were HIV negative. Okay, then 7 people. Faith, is that you? Okay, welcome. Then 7 people were excluded from the study. The comparison was result as follow. Okay, 99.9% of people out of the 155 persons shows positive. Wow, shows truly positive after checking with their blood. Okay, and 99% persons of the 724 persons that were not positive corresponded correctively. There is 717 persons reported negative after checking with their blood. Okay, so that is to show that this is very, very effective. It is very effective. Okay, can I get HIV by using? Oh, you cannot get HIV by using this test kit. Okay, so please, you cannot get HIV by using this test kit. A negative result means you don't have HIV/AIDS. A positive result means you have HIV/AIDS, and you must run to your facility to go and carry out blood tests to really, really confirm. Okay, that is what it means. Can I get incorrect or false negative result with this test? Yes, you can. An incorrect false negative result can occur if you had a risk event less than 3 months, or you are incorrectly reading the results, or probably you do not. Where can I go? So for those that are saying they are positive, where can you get additional care? You can get additional care in your health providers, in your facility, in your what did they call it? They used to call it hospital. You can go to the hospital and they will still carry out the one for blood for you. So let's dive into the matter. So the first thing you need to do is get your stopwatch, because we are going to be getting 20 minutes read. So this is it. I don't know what I said. You're making me feel uncomfortable. You're making me feel uncomfortable. I said, you will still let, I will still teach you, or you will just watch. I will still teach you. I don't know. You're making me feel uncomfortable to say. So that is it. You will need a way to get the time. So you get the time, 20 minutes. Okay. So now let's open the kits and listen. So this shows how you're going to do everything. As I told you, this is the stand, the test stand, very important. Then this is yup, it's two inside. You can see that this let me see, this is the liquid that you are going to use. Then this is the instrument you are going to use. Okay, this is the liquid that is going to tell you the result, and this is the instrument. So let's look at it. This is what you are going to be using for the test. This is very sterile, very sterile. So you put it. You don't need to be touching that. Look at the liquid that you are going to use. You don't drink this liquid. Do not drink this liquid or open it and pour. Okay, this liquid is very, very important. You don't need to drink this liquid. It's not for drinking. It's not for consumption. Look at it. Okay, I think this is not showing very well, but you can get it. Please like, say hi. Today the network, I don't know if it's the network, the follow rate is quite network. So this is how you open it. Look at it. So let me keep this one place. Look at it. I want to show you how to do it. Look at it. You take it, you swipe up, you swipe down, and you place it inside the liquid, and after 20 minutes you read your result. Okay, so this is the liquid, you place it inside. After 20 minutes you read the result. Look at the time. After 20 minutes, result is out. So the result will now show if positive or negative. Okay, Look at it. When two line is just like pregnancy test. When two line is showing, it means it's possible positive. When one line is showing, it means it's negative. Okay, let me show you how a positive result and a negative result looks like. Look at it. This is a positive result. Two lines are showing. Okay, two lines are showing. Then this is a negative result. Only one line is showing. How best can you view that? Okay, so if you do it and you see two line, it means it's a positive result. And if you see one line, it means it's a negative result. If you do it and you get a positive result and two lines are showing and you get a positive result, you should hurry up to the hospital and check yourself. Check with a blood test, a blood test, a blood test, a blood test to get very, very accurate result. Okay, so now let's dive into the procedure proper. So I told you I'll be needing. Okay, back to what is inside here. After that, I think the next thing is inside here is a preservative. Is a preservative to preserve this sterile stuff. Okay. Look at the preservative. You know, this is silica. This silica. This is just preservative. Okay, so you don't eat this one, you throw it away. You already know. You don't eat these things. You might have been seeing it in your cracker bars and a lot of things, so you don't eat that. You throw it away. So let's take a closer look so that let's come closer. Okay, I'll be needing here. Okay, I think here. Okay, here is better. Here is better. So I'll place this test tube. Okay. Let's see. Oh, it's gonna be. So this is practical. Okay. Let's keep this here. So I want to teach you how to place this stand first. Okay. So you see this way. Look at it. You place it slantly, not no, like this no, like this no, like this no, like this no. So you place it like this. Look at it. Place it slantly like this, steady, like this. Okay. So this is the placement of it. That is the placement of it. Okay, let's take the sample. So this is how you are going to take the sample. Please don't touch this place. No, no, no. Don't touch this place or this side. Okay. So this is it. This is where it's going to tell you the results. That's it. Where you will have the positive or the negative. Look at them there. I've said, Faith, look at them there. I've brought it at the saying you want to give him and down before. I don't know. Is this one on 800? That is 800 now. Okay, you can still give him that one. Anyone? Okay, I just want to show you. I've showed them before. So, this is the test kit. For the inching, ow. So look at my lipstick to show that I've used one part. Okay, I've used this part. So I'm going to turn to the other part and I'm going to bring it down. Look at it. Whoa. So sample perfectly collected. What I did was sample collection. Okay, so sample perfectly collected. Okay, what you do is use one side of it to swap the up. Make sure it touches your gum. Yeah, your gum. Yeah, don't ask me gum of teeth. You already know. Not your teeth. Make sure it touches the gum. That fluid that is in your gum. Let it touch. Then you turn the other side and use it for the down part of your gum. Okay, the up and the down, you take it like that. Then the next thing is to dip it into your test region. Okay, I think it's so. Now this is it, to put it into there. Look at it. Why look at it. It enters perfectly well. So you place it here and wait for 30 minutes. Where are my followers? Who are those following me? Please like now. Like. Who are those joining me? Like, because you are waiting for 20 minutes. 20 minutes to get the results. You're waiting for 20 minutes to get a result. So like. Waiting for 20 minutes to get a result. Can I get an incorrect positive result? So while we are waiting, let's see what we can be doing with our time. I think today the joining of the live stream is quite not much, but please like. So I told you, don't use mouthwash, okay? Don't eat and also don't drink before you are carrying out this test, okay? Make sure you are up. You don't do any of that before you carry out this test. So while 20 minutes is waiting, let's stand up and have some fun. Oh. Woo. So we are waiting for 20 minutes to get our results. Yup. So let me just show you the people that are just joining us, joining our live stream while I wore this. Okay, 20 minutes to go. So let's look at it like this. So this is you carrying out your wash. Okay. Then this is just things inside the tube. This is how it looks like. This is you opening it to bring out the content. Tear open the pouch containing the tube. Tear open the pouch containing the tube. Your test kit contains 2 pouches. They are telling you it contains 2 pouches. Tear open the pouch containing the tube. Look at them. Tube that contain the fluid. Then look at how to open it. Remove the cap. Easy. How to open it: remove the cap. Then is a caution: do not pour out the liquid, do not drink. Do not pour out this liquid in this place. Don't pour it out or don't drink it. Okay, this liquid that you've opened, do not drink it or pour it out. Then this how I told you to place it. Slide the test tube in the stand. You already know the stand. This stand, this stand, you slide the test tube in the stand. Okay, then time for bringing out this. Okay, you bring out, what did I say? Tear open pouch containing the test device and remove your finger. Do not eat or swallow the preservative. As funny as I'm be laughing, some persons might want to eat it or swallow it. So do not eat or swallow the preservatives. Then do not touch the flat part. This part. This is a flat part. I know I've shown a lot of persons. Do not touch this part with your hands. Okay. Then this is the preservative that I said you should. Preservative throw away, not needed for the test. Do not eat. Okay, so you throw away this preservative. Then this is it. Press the flat part firmly against your gum. Swap it alongside your upper ones and your lower ones. Just once to swipe it. Press the flat part firmly against your gum. Swap it along your upper gum and once and your lower gum once. Then wetness. You put the flat part all the way into the tube until it touches the bottom. Okay? You just put it until it touches the bottom. Then after that, leave it there for 20 minutes. Leave it there for 20 minutes. That is what you are waiting for, the 20 minutes, before reading the results. Do not read the result after 40 minutes. Wow. Do not read the result after 40 minutes. So if you are not ready to do the test, don't start, because they say don't read the result after 40 minutes. Okay? So now, look at it. To get a positive result, it means that 2 lines will show. 2 lines means a positive result. Then 1 line means a negative result. Okay? So if the 2 lines and this one of the line is faint, it means that there might be, it's still a positive result. Maybe you just contacted the HIV recently, newly. Okay? So it means you need to go and carry out blood test. Okay, even if it's 2 big heavy line that you're showing there, it means you need to go and carry out the test immediately back in a laboratory or in the hospital where they will take your blood to carry out the test properly. Okay, read the results after 20 minutes, after 40 minutes. Don't read after 40 minutes. Okay, so invalid means nothing is showing. You did not do the test very well. Invalid means you just did not do the test very well. Okay, not sure of results. Do you know? You do not know your results when you are unaware of the result. Okay, so remove the test stick and put the cap on and throw away all the contents. You trash everything after that. I think you should follow the back, please. Sorry. Trash everything after use. Visit the health center. So you can also visit the health center. The test did not work properly. Visit your nearest health testing center or health facility to test again. Ooh, that was a long one. A long one. You can order for your kids. You can order for your kids and it will get to you where you are in a location, okay? Order for your kids and order so that you get to where you are in your location. So that was a long one. That's where the long one. So we are still waiting for the result, but while waiting for the result, let's get ourselves happy. Please, who brought Fanta? No, I don't take carbonated. So who brought water? Please, let's share to it. Wine, who have wine? Please, let's share to wine because we want to see our results. Even me, I don't. I don't want to say. So who brought wine? Even me too. I'm skeptical. I am nervous. Even me. Even I'm nervous. So don't mind. You already know my status, okay? I already know my status. Don't mind. So bring wine. Let's cheers to what we see right there. As you can see, no hand have touched. This one is live stream. So it's streaming live. Please, if you're joining me, gives a thumbs up. I know network is bad today. Network is bad, but gives a thumbs up. Network is bad. Limiting me, but that is it. So let me be showing you this thing. So who have wine? Drop the wine, drop the word. Please like, please love, please love, please subscribe, follow me. Today is Wednesday, and it's exact time my followers come online. Oh, please like. Okay. 20 minutes. It's almost 20 minutes. How many minutes have we spent now? Almost 20 minutes. Time to check the result is almost 20 minutes. Don't check your result after 40 minutes. After 40 minutes, don't check it again. Go and buy another one and do it. Order for this, or you go to your health facility. Maybe they might give you free. I don't know. I can't say. But order for this. So yeah, if you're gonna join me next time, we are going to be showing everyone how to do pregnancy test, okay? So if the month have ended and you have not seen your shama, your flow, you have not seen your shama, you should be ready to join the live stream because I'm going to teach you how to check if you have swallowed frog. If you have swallowed another bigger shama, or if you have not, okay? So you are going to join that next time. I'll be dropping details on everything where we are going to see ourselves and how we are going to join the online. I'll be dropping details on that, so you are going to get yourself ready on that, okay? So that will be for next time. So 20 minutes we're waiting. Let me not fall and dance and form my result. Check all the routes at the back. You see, pharmacists, your medicine experts, Association of Community Pharmacists, Association of Community Pharmacists Nigeria, Association of Community Pharmacists Nigeria, Association of Community Pharmacists Nigeria, Bayelsa State. I think it's 20 minutes already. I'm even tired. This network, man, I don't get sense. See inside this thing. Let me read the bad English on. You not go follow the way them take talks say you supposed do the test. For you to get the correct result, make you no chop or drink anything for like 15 minutes before you begin the test, or make you no use mouth cleaner clean your mouth for like 30 minutes before you go begin the test. Omo, to read pidgin English is not easy o. Warning: if dem dey treat you for HIV, the result no fit correct o. How person go use the oral quick HIV self kit? Aya, dis thing warning: make you no use the test if you dey HIV positive. Let me read this one sweet me, e sweet me. Make you no use the test if e don dey open near some things wey dem dey take clean house. Make you no open any of the pouch till you don ready to start the test o. No go chop or drink for like 15 minutes before you start the test. Make you no use anything when dem dey take clean mouth like mouthwash 30 minutes before you start the test. Comot anything wey you put for your mouth kpatakpata, or anything wey you take cover your tongue, your teeth before you do the test. Wow. If e be after use outside the pouch, make you no use the test. Everybody must get light when e reach to fit read the test. Our eyes are blind. So the things wey dem talk for here, e too plenty. But na wetin dem talk o. All me wetin I wan tell you say, if you buy this kit, or if you get this kit, or if you go to health provider, I'm not sure say dem dey sell am, but if you go to your pharmacy or anywhere and dem use this oral kit for you, make you try go back to hospital or laboratory make dem use blood take do the test for you, because na blood na im go fit give you the correct ogbonge result. Okay, all these things kits dem dey give you the correct result, but dem no dey give you that 100% result. Na your blood go give you the 100% result. Okay, so when you use this one, you see negative result, still go to the hospital. Try and do, no fear. As you don use this one now, e go give you that boldness say anyhow e be o. So if you see positive result, still go to the health provider, go check. E no cost, still go check and know your real status. Okay, so no fear, e no dey kill. The only thing last you go take drug and you go be fine and healthy. But when you no detect am quick and you no treat yourself quick, or you no wan treat, na that one you go be say last wetin go happen, e go even big pass you when you get the distance. So abeg, no fear to carry out your HIV test. Oya now, make we check our results. Close your eyes first. To tell you say na ogbonge thing we do, na so the results come out. So as the results come out, na only me, because na my results, na only me get this thing to see am. You see, na so you go take do am. After you don see your result finish, you comot your this thing, then you come close your liquid back. You close your liquid back, then you throw away your liquid, you throw away this one, and you throw away this one. I don tell you, just like pregnancy result, 2 line come out, it means say na positive. 1 line come out, it means say na negative. As you dey see 1 line for here, so it means say na negative. But when you see 2 line, it means say na positive. Even me sef, I dey still tell myself, I will still do the, but I don't already do the blood though, so I already know my status. So if it's the person where you don't know your status already before, still go carry out the blood though, e don cost 1,000 or thereabout. Some places no even reach 1,000, 1,500 like that. You don't do am. So go carry out your own lab test, okay? So me, I want to discard it. Discard. Throw away. The discard English too much. It means you should throw it away. After use, you throw it away. So thank you guys. Abeg, let me remove this one. I'm tired. Ogini. Yeah. So thank you guys for staying. Thank you guys for following. For those that joined through Facebook, thank you. For those that joined through TikTok, thank you. For those that joined through my YouTube community, thank you. For those that joined through WhatsApp, thank you. For those that were passing by and decided to stop and see this beautiful lady is saying thank you. For those that just swap and pass by, thank you. And for those that like, thank you. This section was not like more interactive like my other section. It wasn't that interactive, but still, thank you all for joining. I think it's the network around the state and also probably the MTN network around the country is quite annoying. So let's blame it on the network. Thank you guys for joining. See you next time right on this channel. See you next time, where we are going to be touching on how to use pregnancy test. Okay, how to do pregnancy test. We are going to be talking about that, but I will have to make sure I see some visible people online before I'll be doing that. Sorry for that. You know, so thank you guys. Let's arrange our shelf back. Thank you guys. So I'm gonna see you guys next time right on my channel. Okay, bye. See you next week. Next week. Probably see you next week. Bye. If you enjoyed this section, please share. Share. Comment. Share. Comment. I know Nestor gave us some cut bridges, some kind of thing, you know, but share. Comment. Share. Comment. Okay. Please. Share. Please. Comment. Please. Like. Please. Like. Please. Share. Please comment. Please subscribe. Bye.